So have you ever felt sick and used Google to find out what it may be? What was your experience? At GYANT, we have one vision, and that is that we want to make diagnosis free and for everyone. So imagine that situation: you wake up in the morning and you feel really sick. What are your options? A lot of people actually turn to So a lot of people actually turn to Dr. Google. Google gets 1 billion symptom-related searches every month. And we believe this is a big problem, because it's obviously one of the weakest points that Google actually has. So let's go back to the situation. You wake up in the morning and you feel really sick. What are your options? Imagine now you had a good friend who happens to be a doctor. And that's exactly the experience that we want to build at GYANT. Your friend, the doctor. So GYANT leads you from your symptoms to your likely condition just by asking questions and listening to your answers, just like a doctor would do, but through artificial intelligence. And we're a team of founders coming from the world of social networks, of games and e-commerce. And so we believe that products in the healthcare world shouldn't smell like a hospital. We want to build products that people love. And our first product was a checker for the Zika virus. And 350,000 people have used it within the first 4 months. So how did we get all these people to actually come and discover our service? I'm so sorry. We used influencer marketing. From the experience that we've had starting our last companies, we know influencer marketing better than most. And why is that important, that we had these 350,000 people using our checker for the Zika virus? It is important because we're using machine learning. So we believe that if we can drive a lot of usage, we can generate a lot of symptom data, and we are applying machine learning to increase our accuracy. And the good thing about this is that this has actually worked. The sensitivity, the detection rate for Zika went up significantly. We're now getting funding from the Chan Zuckerberg Initiative and from Stanford to continue to collect data. We have built the second largest data set on Zika in the whole world. We have tested 2.5% of all the Brazilian population in childbearing ages with our tool. 2.5%, I think that's a fantastic number. So what is next for us? Our first customer is one of the largest global pharma companies, and they pay us to drive awareness around a condition, pre-diabetes. That's a very similar thing to what we've done with Zika, and it's going to enable us to grow further in the future. Why do these companies turn to us for that? Because we're a team from the digital space, from the consumer space, from games, from e-commerce. And the companies that my co-founder and I have started drive around $100 million in yearly revenue at the moment. And we believe that the healthcare industry will be disrupted by consumer products. And that's how we're following our vision of making diagnosis free for everybody.
Let's go, good job. Let's turn it over to the judges for questions.
As you roll it out from Zika to a much broader set of triage, how do you seed the triage tree, and how do you actually close the loop and figure out which ones are working better and which ones aren't working better so the AI gets smarter?
Yes, so we're starting with the standard triage protocol, so we have a good starting ground. They're used by 75 million times in the US every year. And from there on, we're generating feedback data. So it's very interesting. 75% of the people who went through the Zika flow came back to us the next day to report their symptoms. And when we monitor the symptom development, this gives us important clues about whether we were right or whether we were wrong.
So it seems from your business model, just in reading, that you are looking to sell into pharma. And I would presume for pharma, what they're looking for is branded decisions of potential new patients, right? So how do you close that loop from being a diagnostic tool to ultimately the physician who's going to write the prescription for products, et cetera? I'm just trying to connect your business model to the product that you're building in the solution.
Yes. So what we're seeing is there's a lot of demand from the pharma people that we've been talking to, and we're a young company, around increasing awareness for certain conditions. And so, like, for example, in the case of pre-diabetes, there are a lot of people out there who are pre-diabetic but have not known about this. So we're actually just sending people to a pharmacy to get tested, and that's what they're interested in, and it will naturally increase the demand for their product. We've also seen that there are many markets where there's like a single player in the market that owns a large share of the marketplace. So in the moment that somebody gets tested and is diagnosed with a certain condition, he will turn into a customer of theirs, you know, with a very high chance.
So I think your backgrounds into this space is very relevant. It can bring a refreshing kind of momentum into it. Retention seems to, of the 350K users, how many come to look for other things?
A third. So a third comes to come back for other things. The Zika checker wasn't built for retention, right? I mean, you don't check yourself for Zika every 2 weeks. If you do, you have probably other problems. So, but we've seen that the retention rate is very high, 75% for the next 3 days. So the time when people still have the symptoms, Zika is like a flu-like disease. So as long as they have symptoms, very high. Obviously for Zika,
it's less about the Zika, of course. It's about trusting you as a brand. If they trust you as a place where you could do future triage of other things, could you build the brand to be a place where I could have this kind of conversation and starting point of triage? Like, do you get the mind share of, okay, I could start here, and
yes,
this is a better flow, right? And then how do you measure and drive that? It relates to the question of how do you build the most common triage paths, but also getting that group of people to come back on a consistent basis so it becomes a habit.
Yes. So we come from the world of games, so making people come back is actually has been our, you know, what we've been working on in the past a lot. We've seen people come in through Zika. Zika is a topic that travels very far. A third of the people come in again and do another diagnosis in a very different field. That was a good thing for us. We've never pushed that. We've never had anything done on that. But what we're doing as well is we're keeping people in a constant conversation. So we've started to build editorial flows about how you move, how you do, and some of them are more provocative. What color was your poop this morning, right? And we do these things just to activate people and draw them back in and keep them in a constant conversation. And I think that contributes to the numbers that we're seeing on the retention side.
What do you do with the data that you're collecting, and who owns it? Is it something that the patient owns and that they can share with the doctor if they want to, or is that up to you to send that to the pharmaceutical companies? Or
it would be, and it is on our plan to be able to share this into health records or into providers, but we don't do that right now. So right now it's just with us.
But it's up to you, if you can decide what you do with that data.
Yes.
You own the data.
Yes.
And what's the customer acquisition model?
You just asked for the customer acquisition model, but your microphone didn't work. So customer acquisition model is my past. For the last 10 years, I've been working closely with influencers. So what we've done for this is that we have reached out to YouTubers in Brazil, and we told them, look, Zika is a big problem in your country. So, and GYANT is a robot that gets smarter the more people talk to it. So share this with all your friends, and let all of them talk to GYANT, and together we may be able to combat Zika. This was the story we told, and that started to spread.
What's the psychological contract, especially in the early days on all these other diagnoses, in terms of the liability and how accurate you are? Is it use at your own risk, or is it that we're going to be as good as your doctor?
We make it very clear that we're not a doctor, but that we're an artificial bot, and we play with that. We've turned it into a charming element, and it is our ambition to be much better than Google.